All right, let's go ahead and get started. This looks a little, there we go. So let me start off by saying, you guys, so many of you guys have joined and registered to do this webinar. So many of you guys submitted questions, which means that changed I changed what I was gonna do. Like, listen, I want to share my story with you guys before I go into it. There's so much information. There's so much information. I mean, these are just the questions. I cut my studies. Like, I need you guys to understand. The biggest thing I want you to understand is this, that when you're going through what you're going through, like when you lose your thyroid, whatever that experience might look like for you, it can feel very alone. It can feel very alone. I know what that was like for the first like 10 years of living without a thyroid. But um, you're not. That's the biggest thing that I realized with doing this webinar. I was like, oh my gosh, there's so many more people out there that are not only living without a thyroid, but that are also waking up and realizing, hold up, I need to start learning about this. I need to start figuring this out because something in the medical system, no matter where you're at, we have people here from all over the world, is not working. And you are not alone. Some of you guys are really suffering. I've been there too. I mean, I have listened to, look at this. Out of all the questions, guys, look how common this is. Even when my thyroid levels are considered optimal, impossible to lose weight. What can I do to help my brain? I'm having trouble connecting my thoughts. I'm constantly losing my train of thought. These are multiple people, guys. I struggle with my weight, brain fog, low energy, reduced desire to do things, memory problems, depression, lack of spark for life, fatigue. Here's some more here, anxiety, nervousness. Another one, brain fog, muscle and joint aches, anxiety. Is there anything to help with weight loss? Um, I work out. I watch what I eat. How bad is the fatigue and the brain fog? Here we go. When does the hair loss stop? How can I maintain my weight and weight loss? Why is it so hard to lose weight? What helps weight management? Guys, let me see. Tired in the afternoon, even with caffeine. I mean, I could go on and on. I want you to know this because a lot of you guys, you're listening to that and you're like, yeah, me too. Let me go ahead and tell you this. Number one, yes, there's so many of us that are waking up and saying this is not okay. But I want to create a clear distinction here, okay? That just because this is common does not make it normal. We're not going to play that game tonight, okay? I always say that living without a thyroid is harder. It is, plain and simple. Like, we've lost the vital organ, regardless of how your doctor approaches it and your family members and whatever. Losing, I'm here to tell you, I get it. Living without a thyroid, I'm not talking about a year. I'm not talking about 5 years. I'm talking about for the rest of your life is going to be more difficult, but suffering is simply not okay. This right here, and I mean, I can apply this to many things, like women's hormones and men's testosterone, but this right here is not normal. Okay? They make it common. So if they treat you all the same in this broken system, okay, then you're going to look around and feel like you go to these Facebook groups and you go to these discussion groups and everyone's doing this, suffering with the same things. So you get sold this idea that this is what it's like to live without a thyroid, and that's completely wrong. Okay, I am going to go through and answer a lot of these questions here. Not going to be able to answer everything. I'm not going to be able to go through all of the information that I have for you guys. I am going to talk to you guys about my Thyroid Inner Circle membership, my community group. That's where I'll be able to answer a lot more questions. There's a lot of resources on there, a lot of resources, especially with blood work, T4 to T3 conversion, fasting, nutrition. So I'll share that with you guys. But I am going to be answering a lot of these questions. So before we get started, let me tell you guys why I do what I do, because a lot of you guys might not know who I am, what I do, and all of that. But my story starts before that. I was 16 years old and I got a gallbladder attack. I was walking into a movie theater. Before then, I didn't think my health was that bad. Like I could have lost some weight, like I had reoccurring stress, I had reoccurring ear infections. Now looking back with what I know, it all connects, right? But at 16, I was walking out of the movie theater and I had a gallbladder attack. I fell to the ground in such severe pain. I thought I was having a heart attack. Rushed me to the emergency room, put me up to morphine because of how bad the pain was, um, and then cut out my gallbladder. And I remember them telling my parents, no big deal. We got it taken care of. And I remember in my follow-up thinking, this can't be right. This can't be right. Like, how is it at 16 I have a gallbladder attack? Something should be different. Like something needs to change here. And I remember going to my doctor. And here in the States, we used to have something called a food pyramid, right? You guys might remember what the food pyramid is. I remember asking my doctor, like, hey, maybe I need to lose weight. Maybe I need to just do something. I feel like I need to figure something out because of what happened with my gallbladder. And this doctor was like, oh, yeah, gave me a Xerox copy of the food pyramid and sent me on my way. And so, because my doctor didn't think it was that big of a deal, I guess I was like, I guess it's not that big of a deal. Number one, there's a direct connection between your thyroid hormones and your gallbladder. Okay, a lot of you guys have gallbladder issues. A lot of you guys have had your gallbladder removed, either before surgery or after surgery. Guys, it's connected to thyroid hormones and to sex hormones, but no one told me. That was a big red flag, but no one told me because cutting it out is the answer, right? And then 3 years later, I was driving, had a huge nodule in my neck. Oh, well, it was like, I mean, you could see it when I would turn. My mom saw it. I ended up going to the doctor's office and they did all these tests on me and I had the follicular variant papillary carcinoma. And I remember sitting in that doctor's office hearing the C word. I remember it was like I was watching myself. A lot of you guys can connect with this, right? Like that out of body experience of hearing you have cancer and then hearing the doctor say, well, you have the good cancer. And I remember like, what? Why is it the good cancer? They think it's a good cancer because they can cut out this vital organ. They can put you on a pill for the rest of your life and send you on your way. That is not good. Listen, any cancer, no matter what type of thyroid cancer you have, there's no such thing as good cancer, plain and simple. Okay? And I remember making all these decisions out of fear, right? But I was like, hey, if I get this cut out, everything's going to get taken care of. I'm going to be well. Things are going to be better. Everything's going to be fine. So we rushed in, got a complete thyroidectomy, didn't get a second opinion, didn't get a third opinion. They gave me high dose radiation, which looking back on my medical records was completely unnecessary. I remember sitting in the hospital then with isolation. They kept you in the hospital here. And I remember feeling so scared and vulnerable and alone because my family couldn't be there. I remember the nurse came and she had this like modified hazmat suit and had this like metal canister with the radiation pill in it. And I was standing there, 19-year-old girl in a hospital gown about to drink radiation. And I can honestly say two different things. I really blocked out that period of my life for years. I had to go back through my medical records to remember everything because they made it seem like it was no big deal when it was a big deal. And I had no guidance after that. They sent me on my way. I was temporarily on some T4, T3, and then they just kept me on T4. And actually, T4 worked for me until it didn't. And that's where my issues started. I started to have weight gain. My menstrual cycles started becoming irregular and didn't come. Sometimes I didn't know why. I struggled with depression. I felt down, even though I loved college. I was in college. I loved my friends. I loved the church I was a part of, but I couldn't shake this feeling of depression. Like I just feeling down, right? And then I also struggled with anxiety. I was always anxious. I would stay up at night. I was tired, but I would replay things over and over again in my head. And I was so frustrated. But I would go to my doctors. I would tell them I was feeling this way. I would ask for labs. They would do the labs. They would tell me that everything looked good. And I was sent on my way. and it made me feel freaking crazy. And I think a lot of you guys can connect with that, okay? I lived like that over and over and over again until, oh, let me tell you this. I started doing CrossFit. I started working out hard. And then I decided to be vegan. And when I was being vegan, I was very restrictive with my diet and I still couldn't lose weight. I couldn't understand why I wasn't seeing the results that other people in my CrossFit gym were seeing. And I remember one doctor just looked at me and said, do you understand calories in, calories out? Essentially telling me to eat less when I was already restrictive. So I became raw vegan. I was undernourishing myself. I was punishing my body because I didn't know what to do. And I was scared that this is how I was going to live. I got into a car accident. On top of everything, I went into a doctor of chiropractic's office, and it was the first time in my life that someone stood in front of me and talked to me, listened to me, taught me how to heal my body, taught me that my body's created to heal itself, and told me, hey, if this is all happening, that they're missing it. There's something missing there. And at about 20 or 21, I drew a line in the sand and I said, hold up. No one's going to know more about me than, no one's going to know more about my health than me. No one. Because what they're doing is not working. And if I feel this way at 20 or 21, I don't even know what it's going to look like when I'm 40. And so what I ended up doing, I started researching. Okay. I ended up looking at labs. I looked at medication options. At 20, 21 years old, I fired my doctor. I ordered the labs that I wanted. I got the medication that I needed. And then I started healing my body. And my life has never been the same. I was going to be an eye doctor. I became a DC and a functional practitioner because of what he did in my life. Okay. I don't prescribe medication, but let me tell you guys what I do. Because one thing you guys, a lot of you guys need to realize that now that you're living without a thyroid is that you cannot walk into a doctor's office anymore and hand them over your health. You have to be a knowledgeable participant in your health. And I love it because there's multiple questions in here like, how do I advocate myself? What do I ask for? What labs should I get? I'm going to touch on some of that. I go deep into that in my thyroid inner circle. Guys, if I could fire my doctor and then I started healing my body, I had to start detoxing, I had to start doing lymphatic work, I worked on my gut health. And over those years, I never looked back. You guys are suffering, you guys have symptoms, you guys have all these things going on. Actually, some of you guys might not even feel bad, but we do know now with studies, okay? There are higher risks, okay, to the fact that we need thyroid meds, how much thyroid meds we need, and the effects it might have to our heart, to our bones, and even to other cancers. So, the biggest thing I need you to take is that your life can never look the same after this. Okay? You have to know what's going on. You have to know how to advocate for yourself. You have to be okay with firing doctors. And I know there's people here in other countries, and you're like, oh, this system, listen, in my inner circle community of people all over the world, I find private clinics, I find supplements, I find testing for them because the truth is, if you stay in that system, if you stay in that office and they're not helping you, it's called insanity. Doing the same thing over and over again and expecting different results. Okay? This is why I do what I do. If I can take my pain, and you guys have all have different journeys, right, of how you got here. Okay. Some people, it was Graves, Hashimoto's, nodules, cancer, whatever. We all have different. I can tell you this to this day, it's the biggest regret for my health that I've ever done. But I take something that's really painful for me, something that pisses me off and frustrates me with what doctors are doing with you guys, and I use it to fuel me to teach you, to educate you, to empower you, to equip you so that you can go into that medical system, get what you need, then be less dependent on it and heal your body and be optimal long term. That's why I do what I do. This is who I am. Now, I'm going to go ahead and jump right in here. I want you guys to understand something. So for the longest time when people worked with me, they would say like, oh, I wish you could prescribe my medication. I wish I could get medication from you. This is the thing, guys. I had two really bad situations happen. One where this woman had been working with this amazing doctor and then he died. And she just kept seeing the person in his office. And she was without a thyroid, out of medical range. This woman, this new physician, kept her low. She had reoccurrent small intestinal bowel overgrowth, SIBO, yeast overgrowth, skin issues, and she had no idea. Had another situation. Fantastic nurse practitioner, loved her, got her on medication. It was everything that she needed, then disappeared. They had a falling out with the clinic and the nurse practitioner, didn't have anyone to go to, put their health completely dependent on a person out of medical range. I need you guys to understand this. It's not finding a doctor that's going to give you exactly what you need. It's about finding a doctor that's going to listen to you, because now you're going to be well informed. Now you're going to be well educated. Now you know what's going on because you're going to learn all these things. You need someone that's going to say, hey, they might not agree with you, but they'll say, hey, we can try it. Or, hey, we can do this. Hey, we can track this. Hey, I've in the years, I've had doctors that will work with me, right? Like to prescribe me medication when I was in school and they would tell me, okay, yeah, we'll do this. I'll see you in 8 weeks. I'd feel better if I saw you in 6 weeks. And can I message you in 2 weeks if I'm not doing well? That is what you're looking for. Too many of you guys are looking for doctors, endocrinologists, whose specialty and toolbox is this, whether it be surgery, meds, uh, surgery, meds, what else we got? Labs? I mean, they don't even do labs, a lot of them, comprehensively. You're going there and you're asking them to do something out of their toolbox. You're asking them to teach you about nutrition, or asking them about if this is related to your gut health, asking them to do other things that either they don't feel comfortable with, that they don't know about, or they don't care. Okay? So all you need is someone that is willing to listen, and you need to go in there prepared to do shared decision making. That's the only way. Because you need to be able to go to any doctor's office, any point in your life, and know what to ask for, know what looks good for you, know what doesn't look good for you, know what medication, know what option to use. Because here, let me go ahead and tell you a little something. Someone asked, someone asked here, I don't really know what to do. There's so many different programs out there. What program should I do to help me? Well, first of all, you should do my program. But that actually, what I need you guys to understand, unless you've lived without a thyroid, I can tell you this. I go off of studies, but studies are not the gold standard here for me. I go off of what I've experienced because I push the limit with myself. I experiment. I'm going to do whatever possible to make myself as healthy as possible. Okay. And I've also been coaching a decade with people that have been living without a thyroid, right? All over the world. So the things that I share with you, what I share in my inner circle community, even things that I share here, might not be in a study yet. Okay. I'm just going to tell you things that I see, and you guys are going to be like, what? Yeah, I've experienced that. Or no, I didn't know that, right? And let me tell you something. I interviewed Dr. Bianco on my Thyroid This Life podcast. This man did 35 years of research on T4 to T3 conversion. 35 years, okay? He was against free T3 testing. He was against T3 medication. And you know what changed his mind? Number one, because he cares. Okay, there are doctors out there that care, right? But what changed his mind is patients saying, I am not okay, and I am not going to settle for this. He told me two different stories, and actually, if I remember correctly, both of them, when he told me this, I was like, both of them are women living without a thyroid. And he saw in them that they were not okay with the standard, the international standard for thyroid meds and thyroid testing, or the US standards for thyroid meds and thyroid lab testing. He saw that they were not, and he decided to look into that further and he changed how he did things. So remember, N equals 1. I don't need a study to sit across from a client who says they feel better because this and this and this has changed post-thyroidectomy. You are the study, okay? You are actually living without a thyroid for decades. Unfortunately, you are the study because we don't have decades down the road. So let's not wait around for your health to crash and burn for a study to tell you, hey, this is what we should have done differently. You've got to understand how your body works, how your body functions, how to best support it. So the reason why I said that is because one thing that I noticed post-thyroidectomy is that when some meds work, they'll work for a period of time and then they don't. And then you have to change it. And I think that's a really important thing to understand because you were never meant, nothing about our body is the same every single day or every single minute. Nothing. Our body thrives off diversity, the adaptability, the ability to go up, the ability to go down. Our body thrives off that. Okay. We don't have, like, if you look in the studies, if you can find benefits of eating this way, benefits of eating this way, but the one thing we find, the best way for everyone to eat is with diversity and nourishing foods, right? Diversity. You need diversity. So this idea that you're going to get a level thyroxine and that should be the same for years, and then maybe you might tweak it a little bit, and that's it for the rest of your life is insane. At the beginning of my coaching journey, when I worked with people, I would tell them, yeah, NDT, natural desiccated thyroid hormone. Not necessarily. I've done all thyroid meds in the last 20 years. I've done them all. How do you know you should switch it? Because once you get optimal, you'll feel great, you'll do great, and then all of a sudden things stop feeling great. You're kind of weight loss resistant, you're feeling tired again, you're not feeling well. Like, then you need to look at your meds, right? You need to look at your labs. And every time it's happened, immediately when I switch my thyroid meds, I lose weight, I have increased energy. I say all of that because if all you're dependent on is for a doctor to tell you when, what, how, you're going to miss that. Because guess what? You're the expert. You're the expert in your body. You are the expert in your body. You have to trust that if you are having this brain fog and this disconnect, and this is something that was working, is not working, or it's never worked at all, you've got to trust that no one's going to care more about your health than you. That's my tagline for my Thyroid Inner Circle community. That's why I teach what I teach. No one's going to care more about your health than you. Okay? So let's go ahead and go into this. Let's talk about the phases. So I'm going to touch on my stuff, and then I'm going to go into the questions here, guys. So let's talk about the phases of healing that I think you guys should be aware of. Okay, when we're healing after thyroidectomy, everyone. Sorry, I just saw some questions pop up. I'll see if I can touch on these questions, guys, in the Q&A. But when you're sold on this idea that once you get your thyroid cut out, you're good to go, that's actually wrong. Cutting out diseased tissue does not heal the body. Your body needs to heal, okay? But what I have found with the hundreds and hundreds of people I've worked with healing post-thyroidectomy is there's 3 different phases. Number 1, you got to stop drowning. That's the first phase, plain and simple. You got to stop drowning. You got to figure out how to get your thyroid meds optimal. You got to figure out how to get your T4 to T3 conversion optimal. And honestly, you just got to supplement. You just got to get those nutrient status up. You got to change that diet. You got to do the foundational things. That first phase, you got to sleep. You got to go outside. You got to go barefoot. Like, this is that first phase. It's like you have, your house is flooding. You've just got to stop it, right? That's the first phase. And this matters because, and I've seen it in here as well. We might touch on this. I don't know if you guys know this, but first of all, you got to get your thyroid meds optimal. T4, T3 is the most optimal approach. And then I'm going to touch on, for those of you guys that don't have access to T3, what I need you to understand is the thyroid gland produces T4 and T3. Okay. And so you would think if we want to practice good medicine, like if doctors want to practice good medicine, we want to do things as similar to what the body would naturally do. And what does the body naturally do? A majority of the thyroid creates T4, and then it creates some T3. They say about, what is it, like 80 to 20. But we actually have research now that shows that if you cannot convert, so remember, T4 has to be converted into T3. We have studies now that show that if you have a conversion issue, your body's inflamed, you have blood sugar issues, sex hormone issues, toxicity, mold, Lyme, there's all these different things, liver congestion, that can make T4 to T3 conversion difficult, that if you have that issue, Your thyroid, oh, there's also genetic changes that can just make you not as efficient, right? But the thyroid gland is so intelligent, it's so smart, it's so adaptable that it can make up for that. So if you're not converting T4 to T3 systemically or at the tissue, like at the muscle, brain, your body will make up for that. Your thyroid will make up for that. It will now, instead of doing 80/20, it'll bump up its T3 higher. It will produce more T3 to offset that. So the idea that now you got to cut out your thyroid and you're not going to have any T3 support makes no physiological sense if we're trying to mimic the body. Okay? So right off the bat, T4, T3. But I want you to understand that in that drowning phase, that first phase where you just need to optimize those meds, there are things that are lifestyle related that will make you stop from being able to optimize your meds. Okay? Things like iron deficiency, cortisol, HbA dysregulation, insulin issues, like blood sugar issues, guys. What does that mean? Oh, early on in my coaching career, I would tell people post-thyroidectomy, you're going to feel amazing. We are going to get your T3 levels up to optimal levels. You're going to feel amazing. They would get to a level that isn't even within functional ranges, and they'd feel like, I don't feel good. I feel like this is too much thyroid meds. And I look at their labs and I'm like, this isn't a lot of thyroid hormones. And then I had to redo, I had to go back. This is what functional practitioners do. We go, this isn't working. What do I need to change? And I looked that a common issue that a lot of patients post-thyroidectomy have is gut issues because of hypothyroidism. And gut issues can contribute to iron deficiency and mineral deficiencies like copper. And what ends up happening is that if you have low iron, it's so important for your body that what ends up happening is you go into a hyperandrogenic effect. We have studies on this. The low iron puts you in a sympathetic survival response. So now when you're putting T3 into the body, and even T4, if you're converting it, it's like putting your foot to the pedal and you're going like 150 miles per hour, and it feels that way. You cannot optimize your thyroid meds if the gut's not well fully to where you need to be, okay? But most importantly, things like iron and HPA dysregulation and insulin. Those are three major things. So I've had people, I've tried T3, I just don't feel good. All right, let's go look. Let's look at this. So when I work with people in this phase one, I'm looking at labs, a complete wellness panel. I have courses on this in my Thyroid Inner Circle to go deeper on this. But number one, you've got to stop the drowning. The number two, you got to heal from being hypo, gut issues, SIBO, H. pylori, insulin dysregulation, systemic inflammation, chronic immune issues. So now your white blood cells are suppressed. This second phase is, hey, I know your doctor didn't make it seem like it was that big of a deal because you were within medical range. Well, they're wrong, plain and simple. Your T3 is needed for all your cells to create energy. Plain and simple. You need T3, mitochondria, ATP, energy, all your cells in your body. You don't have enough T3, and you guys, so many of these are like optimal. I don't know. I doubt if you have all these symptoms, it's not optimal. Just because you're in medical range does not mean you're optimal. There's functional ranges, and then within that range, there's a functional optimal range for you, someone who's living without a thyroid. And over again, all my post-thyroidectomy clients, all my community members, where they end up on the range tends to be a little bit higher when it comes to free T4, free T3. But if you just let your doctor do what they're doing, that is not okay. There's a study here in the European Journal of Medicine or European Journal of Endocrinology. What they found is that they followed a group of patients before surgery and after surgery, and they stayed on the same amount of thyroid medication before surgery and after surgery. And their TSH, which TSH alone, that marker alone, is not enough. Their TSH went from a 1 point something to a 5 on the same medication dose. What they found, and we've seen this in multiple studies, they needed at least a 30% increase of their thyroid meds. What that means is that if your doctor is treating you as someone with a sick thyroid, they're more than likely under treating you. Because we know, at least in this study, we see it and we see it over and over again, you need more. Okay? So that second phase is healing from being hypo. This is where you get your parasympathetic. This is where you work on your adrenals. This is where you work on your sleep, and all of that. And then number three, and I want you guys to understand the number three, I'm changing. I'm listen. You listen to podcast episodes of me 5 years ago. It's very different than me today. Okay, I'm changing. I want to get better. I want to know more. I want to know how to improve. And I'm going to let you guys know right now. You want to be part of my Thyroid Inner Circle community because in the next year plus, I am changing how I'm doing things for post-thyroidectomy clients. Okay. Number three is now healing and optimization. Number three is now you're healing from the dysregulation that led you to get your thyroid removed because a healthy body does not create sick tissue. A dysregulated body does. Okay? A sick body does. A body that's not able to adapt. Your thyroid was a symptom of something. Okay? Now, once you're feeling better, now you can go, hey, I'm going to go healing. And the thing that I'm going to be changing, okay? I already have courses on the mitochondria, I have courses on how to increase T4 to T3 conversion. Is in that phase of optimization, I want you to understand that I want you to need less thyroid meds over time. You're like, wait a minute, I just literally got my thyroid meds to a great dose, yes. But we are seeing studies now, long-term dependency on thyroid medication that can increase risks. It's observational studies, and I don't want to scare you guys, and we're not going to go into this because you guys already have all this stuff going on here. I want you to focus on healing and this, right? But there are questionable things that can happen from the utilization of thyroid meds. I had someone message me like, oh my gosh, they said that levothyroxine and higher dosages of levothyroxine increases your chances of cancer, like colon cancer. They're observational studies, guys. It's not causation, right? They're not saying, they cannot definitively say this. But what I want to happen in phase 3 in optimization is how do we change your body to come to a point where you maintain all your metabolic changes and you feel amazing and need less thyroid meds. Most of you guys don't need that right now, but this is a really big deal. This, I think, is going to be the direction for post-thyroidectomy research, or I hope in the next few years and decades, is, hey, how can, even if you don't have a thyroid, how can we physically change the body so that you are more efficient at T4 to T3 conversion and more efficient at T3, and we're going to do it through the mitochondria. That's it. We're doing so much research on mitochondria and cancer. Well, I'm going to say post-thyroidectomy, the two biggest areas, well, three: mitochondria, gut health, and cell receptor sensitivity. I have never done this before. I've never been like, hey, yeah, like post-thyroidectomy ranges at a three, like lower threes. Maybe that would work for you. And I'm seeing it with a lot of the people I'm working with right now. So I want you guys to understand that. Okay. I know we've got got a lot of questions here. Let me just jump into the questions. Okay, before I jump into the question, because I've been talking about my Thyroid Inner Circle community, I'm going to introduce my Thyroid Inner Circle community to you guys so you guys at least know where you can plug in, where you can learn more. Because this is the thing. Unless someone has been living without a thyroid, they're missing it. Plain and simple. I see it. There's a really, really, really big, I respect her. I respect what she does. A really big thyroid clinic. And one of their doctors under her in this thyroid clinic had one of my clients stop T4. And she doesn't have a thyroid. Just so you know, T4 is still important. I'm gonna touch on that. I'm gonna try to touch on this, guys. I'm gonna give you guys so much information, right? It's insane. You should be optimizing T4 and T3. I get it. Everyone hears about T3. T4 post-thyroidectomy is vitally important. Why? Because you have different tissue like your brain and your muscles that can take T4 and convert it for itself in that tissue. So that allows you to have adaptability and be able to respond to things better. And this guy told her to stop T4. And guess what? She did not do good. And she came in to see me, and I was like, she got in my community group. I was like, oh, we need to recover from this. So remember that. So I'm going to share my Thyroid Inner Circle community really, really quick here. And I'm going to answer all of these questions. So just really quick here, guys, my Thyroid Inner Circle community, it's an online community. And if you're in the US, even if you're around not in the US, I am, and I think my assistant, where is this? Here we go. I'm going to share this with you guys, and I'm going to go into the question here. I have people all over the world in this community group. Now, what ends up happening if you're not in the US? I find you resources where you're at because I'm a bulldog, because I want you to feel empowered, because I want you to get well. But let me talk about what my Thyroid Inner Circle community looks like. And you guys can keep sending those questions. My Thyroid Inner Circle community, I created this because I wanted to figure out a way that for the rest of your life, you are empowered, educated, and equipped. That you have the most up-to-date information, not just on your thyroid meds, not just on your labs, on anything and everything you might need to be optimal long-term. And so in my Thyroid Inner Circle community, I do every single month. If you guys like this, I do this every month. Okay, I do a live teaching, or I give you a live course, or not a live course. I just give you a course, right? Where you can watch it on your own, or you do the live teaching live, or you can rewatch it, right? And then we do a live Q&A every single month, and I modify things according to what you guys need. So we do labs. I show you labs. We walk through labs. I tell you exactly what to do with labs. There's video resources, and in my community group, you do have the option if you want it. I have a lot of people that don't ever work with me one-on-one, but in my community group, they just learn through the courses, they learn through the sessions, but you do get a discount. This is the only way moving forward that people are going to be able to work with me. You're going to do that on a discount. Now, if you're in the US, okay? If you're in the US, this is a new thing I'm doing. You will get all of your lab testing and functional testing at cost. You will get all your supplementations at 25% off, and we have a community group. So just to show you guys, if you guys sign on to this, you already have stuff that you can start watching right away. Right away, you're going to understand your labs. And in fact, if you guys join tonight in my Thyroid Inner Circle community, because of so many questions I had here about labs, I'm going to throw in a thyroid labs course specifically about ranges and labs for people living without a thyroid. I'm going to throw that in because I don't think I'm going to have a chance to go through all of that tonight with all the questions you guys have. So if you join tonight, you'll get access to that when you sign on, and you can start deep diving and understanding your labs, right? You have thyroid medication options. What does it mean? What are over-the-counter thyroid glands? Could you use this? Someone was like, what happens if we can't ever get a hold of thyroid meds one day? Well, I got a video in there about thyroid glands over the counter, okay? Next, monthly check-ins. These are my live Q&As. You guys can go in there and start learning stuff. It's all for my group, whatever you guys need in there. You have access to all these resources. Again, you get the discount there. This is for my US clients. Guys, you're going to get lab testing cheaper than anywhere, like stool testing, food allergy testing, mold testing. You're going to get it at my doctor cost automatically from being on there. Blood work, this is the biggest question I get from people is like, my doctor won't order labs. Okay, then order it yourself. You can do this, and I can walk you through it, and then you can go in and talk to your doctor about your labs. I mean, you're saving hundreds, if not thousands, a year in this. And then this is my big one. Changing your lifestyle is not cheap. I know this. I was on government assistance when I went through my thyroidectomy. That was just how it was. I'm trying to figure out how can you guys feel empowered and also stop any roadblocks from you being able to do what you need to do when it comes to your health. I have a whole course in there about supplements. Right now, we're implementing it for all my current membership members and anyone else who joins. You get 25% off supplements. That means if you hear a podcast, if you watch a YouTube video and you hear about this amazing supplement, you'll go into my practitioner shop that you can trust, that is not going to be sitting in a warehouse, that's not going to have a separate label, and you can buy it at 25% off. And this is an example. I just wanted to show you guys this. This is a common supplement protocol one of my clients is on. $167, same price, $233 on Amazon. I don't want any excuses about why you're not getting better. I want to give you the information. I want you to feel empowered and moved. I also want to give you the ability to save hundreds, if not thousands of dollars every single year on any lab testing, functional testing, and supplementation and our community board. So I'm on there. You guys want me to answer your questions? You want to share a picture of what you're eating? Does this look good? That's where you go. Guys, it's only $67 a month, monthly membership. If you guys do the year membership, I discount it. You get 2 extra months. And people like this, you don't have to do it. But with the annual membership, you get a free intro call with me. It's a free one-on-one 30-minute consult to put a game plan together of where you're at and how to access the resources in there. I think my assistant put links in there for you guys. I'm going to try to go over as much information as possible tonight, but this is where we can go deeper. This is where you're going to continue to learn. And I modify my content according to the people in my community group. The doors will only be open for the next 5 days because I close the doors so I can focus on who is in the group. And again, remember guys, if you join tonight, I'm going to throw in that Thyroid Labs masterclass post-thyroidectomy since you guys are here and I'm not going to have a chance to go through all of that. It's just $67 a month. That's it. And you guys save all that money. Now, if you live overseas, I have people in Canada. I have a practitioner in Canada I connect them with. I have people in UK. I tell them a supplement. I look up what supplement they should do that they have available for their guys. My goal is to help you guys save money and to transform your health. So that is my Thyroid Inner Circle community. Let's go in to these questions that we have here. All right, so let's go ahead in here. One of the questions I got asked was about perimenopause, menopause, and post-thyroidectomy. I'm just going to jump on that because I remember that. I want you guys to understand, is there a connection there? Absolutely, completely, yes. Okay. One of the biggest things that a lot of women are not taught is that what primarily makes your sex hormones in menopause are your adrenals. But what that means is that women historically and still to this day, when it comes to their healthcare, are written off. We have spent years and decades being undertreated, undersupported, not given what we have needed for our health. So what that means is we get HPA dysregulation, just hypothalamus, pituitary to the adrenals. We are rushing women. There's that rushing woman syndrome. Things are dysregulated. What that means is not that you have an adrenal issue, but the signaling to your adrenals is dysregulated because you're constantly in survival mode. Now, when you're supposed to transition, just transition. It's a new season of life. Into menopause, you're depleted. Your adrenals are dysregulated. Now this little organ above, your kidneys, they don't, they're not able to respond appropriately. T3, low T3, will always cause you to be in a sympathetic survival response every single time. So a lot of you guys are going out and getting bioidentical hormones without optimizing your T3 or your T4 to T3 conversion. Now, the bioidentical hormones can make you feel better, but oh my gosh, you're missing a major hormone, not just for proper signaling for perimenopause and menopause and clearance of estrogen and optimization of progesterone and being able to make testosterone and then aromatize testosterone to estrogen. So yes, it's absolutely connected and related there. Okay, I'm going to be going back and forth between these questions here. Is it true without a thyroid we are more at risk for heart attack? The issues with living without a thyroid and cardiac risk comes with high free T3, which is why if you're not getting a complete wellness lab panel, which is TSH, free T4, free T3, reverse T3, then you are not getting a true picture of what's happening with your thyroid hormones. Now, here's another little thing that actually I have a study on this that I found through my own health because I'm living without a thyroid and the clients that I've worked with all over the world. Here's my thing. I have found, and you guys are going to be like, wait a minute, what? Because a lot of you guys ask, like, my doctor has kept my TSH suppressed. I feel bad. Is it possible that you have suppressed TSH, but your free T4, free T3 levels are not very high? Post-thyroidectomy? Yep, I've seen it, okay? And I have a study that talks about this, right? Is it possible to have suppress TSH and your T4 and T3 is way too high. Yes, it's possible. But the one thing I see over and over again is that optimal levels post-thyroidectomy when it comes to free T4 and free T3 can leave post-thyroidectomy patients with suppressed TSH. That means TSH below medical range. You guys, a lot of you guys are going to be like, wait, what? What do you mean? What? I thought TSH suppression is bad and it can cause bone issues and it can have heart issues. It does if there's too much T3. T3 is like the gas to the pedal. That's why a complete panel is so important. So looking at those markers is really important. Let's touch on this. What do the studies show about TSH suppression and bone health? So the heart attack if you have too much T3 and your body is just revving, absolutely, yeah. And that's why it's important for your doctor to actually care about doing T3 the right way, and not giving you too much. But most doctors give you too little. And then you guys say it doesn't work. And I'm like, it's because I gave you too little, okay? But let's talk about what studies show for TSH suppression post-thyroidectomy. Number one, I did a deep dive on this. I went deep on this. I talked about it in my Thyroid Inner Circle community group, and I looked into it. These studies never, like this study finds this study finds this, but none of the studies ever look at all of the factors together. What's vitamin D status? Vitamin D is vitally important for bone health. What's magnesium status? Magnesium helps vitamin D get where it needs to go. What's vitamin K status? Vitamin K helps calcium get where it needs to go. What is weight-bearing exercises? What's the metabolic health? They don't look at this all together. The one risk factor, the one group where they do see an increased risk of osteopenia and osteoporosis, which TSH suppression is in postmenopausal women. They do not see it in cycling women. They don't see it in men. But what do we also know outside of the post-thyroidectomy group? What do we know about postmenopausal women? Is they tend to struggle with osteoporosis and osteopenia. Because guess what also is important for bone health? Estrogen. And guess what a lot of these studies do not look at? Estrogen status. So when we're looking at all of these things like, oh my gosh, can it increase my risk for this? Can it increase? We got to look at this full picture. But this is also why it's important. You can't just lose your thyroid and get on meds, depend on your doctor, and not heal your body. That's when you're going to have an increased risk and not even know it. My postmenopausal women, DEXA scan, checking all of these levels, because if your estrogen is off, if your vitamin D status is off, magnesium is off, I mean, yeah, you're going to have an increased risk of that, because across the board, postmenopausal women don't eat enough protein, they don't do weight-bearing exercises, you don't go outside, your vitamin D is in the 20 and 30. This is why I do a complete wellness panel, okay? So that's really important. All right. How important is reverse T3? Let me tell you what reverse T3 is. Reverse T3 is a dynamic marker. Why don't doctors want to test it? Because they're not going to change what they're doing. Who cares to them, right? Like if they're not going to change what they're doing, they're not like, what? But why is reverse T3 an important marker, especially when you're on thyroid medication? Okay, especially when you're utilizing T4 separately, whether you're on T4 alone or T4, T3 that's separate. I don't tend to see this as much with NDT. Reverse T3 is a stress marker, meaning when your body's under stress, when there's an issue, when there's a conversion issue, when there's an underlying infection, inflammation, whatever it may be, your body is going to increase that reverse T3, okay? If you see that reverse T3 high, there's two things you can know. Number one, reverse T3 is competing with my free T3. So why do I still feel hypo, but I'm on free T3? Or why do I feel hypo, but I'm converting my T4 to T3 really efficiently? I've been working on my health. There's something underlying. There's something underlying. Now, another thing to know is that too much T4 when your body cannot convert it and activate it well can also trigger higher reverse T3. But reverse T3 will always compete with free T3, okay? Now, what if reverse T3 is low? Oof. Reverse T3 is low. This is what it's telling me. You don't have enough free T3. Reverse T3 is a backup reservoir, okay? That means when you don't have enough free T3, you're going to pull from reverse T3. to make free T3. So I see people sitting in front of me, people submit their labs for our community group, and they'll say, like, oh, I feel fine. Like I'm like, oh yeah, because you're using up your reservoir, but you're about to crash and burn. You're about to have a storm of hypothyroidism coming up here soon. So reverse T3 is a good marker as a stress like reactant marker to know what's going on. Like if you have enough T3, if your free T4 medication is too much, if you're sick, if you're inflamed, if you have a gut infection or something like that is going on. Okay. My cycle has been about every 5 weeks. Will being on the right dose of medication help it be a shorter cycle? It can. Free T3, your body needs energy. When your body doesn't have energy, you slow down. So think about it. You're driving a car, you're putting your gas on the pedal. You don't have gas, your car's gonna slow down. That means that anything and everything, can this affect my cholesterol? Yes, it will make your cholesterol go up. Can this affect blood sugar? Yep, it'll make your glucose go up, your insulin, you're gonna have insulin issues. You're not gonna get glucose into the cell because you need T3 to utilize carbs, that glucose for fuel. The answer is yes, the T3 will do that. If your labs are not optimal, a lot of you guys have the symptoms that you're having. The reason why you're having these symptoms is because you're not optimal, okay? You don't know what your TSH, free T4, free T3, reverse T3 looks like. Even if like you're in another country, you can't get reverse T3, listen. Free T4, free T3, TSH. One thing I'm working on with my clients overseas within my community group is you don't have access to free T3, either utilizing thyroid gland over the counter as hormone support and or like that's up to them if they want to do that, but working on all the areas that T4 to T3 conversion is affected: mineral status, liver health, gut health, blood sugar, and metabolic health. You can start to feel better. You can start to see a change in your metabolism, even if you're only on T4. You just have to make up for it in your lifestyle. Okay. All right, let's see here. Yeah, here everyone says buy their program, but how am I supposed to know who to follow? I live it. I give you a lot of information on it. You should check it out. Okay. I was losing weight. Let's talk about weight loss in the post-thyroidectomy situation, right? When your T3, again, affects your resting metabolic rate, it affects ATP, it affects like how you're able to burn fat. Like when that T3 is suboptimal, you will slow down, you will gain weight. That's why I always say, like, people that are living without a thyroid, like, you will eventually, working with me, get to a point where your hormones are going to be optimal and then it's going to feel great. And then you're not. And the biggest sign is all of a sudden you're eating healthy, you're doing well, and you've gained weight. And it's a couple pounds, and you're like, oh my gosh, I need to work out harder. Oh my gosh, I'm doing keto and I need to go carnivore. No, 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 no. Slow down. Let's double check your hormones because it might be a season where you need more support, depending on it, right? Stress levels, if you live in a moldy home, this stuff is going on, right? So, in this person, had their thyroid cut out, had difficulty with brain fog, muscle, joint ache, scar pain. Now, I was losing weight with a low calorie, high protein diet. Let me tell you guys something about this that you need to understand with things like high protein, high fat, keto, okay? Um, and then I noticed brain fog and I was stumbling my words. My TSH was back up to a 4. I'm feeling really overwhelmed in this new life with so much information. I get it. I hope you don't feel overwhelmed with all the information I'm giving you tonight. But one thing I need you guys to understand is that lower carb, higher protein, higher carnivore can be, high fat can be fantastic. First of all, most of you guys need to increase your protein. You're not eating enough protein on a daily basis to get essential amino acids. But one thing you guys need to understand is that carbs are not essential. This is true. Okay? They're not essential. And there are studies that show that low calories can, when you restrict calories, you can lose weight. You will destabilize your thyroid hormones long term if you do it too long. Okay? If you eat the right way, I have a foundational course on this, right? This nutrition course. If you are nourishing your body while you're doing this, you should be able to diversify, go higher carbs to refeed. Listen, yes, you can go a period of time with low carb. Your body's going to burn fat. It's going to use its glucose stores, right? But then you're going to get to a point where you don't need to anymore. We're not in a famine, right? And if you continue to act like you're in a famine, that's when your body now gets desperate and starts breaking down tissue it doesn't need to. And that's why you see a lot of like online, I don't know, nutritionists or whatever. They're like, oh, you're doing, low carb or high fat, higher protein. It's going to break down tissue. No, you're going to do it when you're too chronic. And what ends up happening is someone in my group who did this for far too long when her body was telling her it's time to refeed with good, healthy carbs. When you eat good, healthy carbs to refeed and you increase your calories, you're letting your body know you're not in a famine, which means you're not going to be in survival mode. You're going to see a T4 to T3 conversion go up, which you want to make sure that's still happening. And your brain and body is going to feel fantastic. So going low cal, going low carb for too long, you have to diversify in and out, cycle in and out. And you guys should not be getting blood work while being low carb. You need to see if your T4 to T3 conversion is appropriate. So you refeed with good, healthy carbs to see if that T4 to T3 goes up. Okay. So, one really big thing here that I want to say is, guys, just right off the bat, and if you guys don't have the ability to like get TSH free T4 free T3 and you're in the US, you can order it discounted through my Thyroid Inner Circle, or if you're overseas, you can do it privately. Um, Depending on where you're at, we can find you resources for that. But too many of you guys are beating yourself up for an issue that's coming from being under supported, right? And there's things in the lifestyle that can help you, but you guys have got to give yourself a lot more grace. You're like, why can't I lose weight? Why can't I lose weight? Stop punishing yourself like I did when I was vegan and doing CrossFit and doing really intense workouts, guys. You got to start there, optimize it as much as possible. If you only have T4, then optimize that as much as you can, looking at TSH free T4 and free T3, and then work on conversion, work on getting on T3. Someone had asked me, they're like, hey, do you think, let me go through, I'm going to go through these. I'm going to go through these questions. Okay. So I hope that was helpful. If you join the membership community, you can post on the community board there. Let me know if you have any follow-up questions. How can I best prepare for this operation to ensure a good recovery afterwards? And someone asked, like, what are like the top 3 questions to ask if I'm going into this thyroid surgery? Um, number oh, Number one, I would get complete labs done right off the bat. My complete wellness panel includes CBC, CMT, B12, folate, iron panel, ferritin, C-reactive protein, fasting insulin, TSH, free T4, free T3, reverse T3, A1C. I hope I'm not. I'm trying to think of it off the top of my head, right? First of all, we want to start there. So the first thing I'm going to look at is, listen, my body is going to be dependent on these thyroid meds. Number one, are you going to do a complete wellness panel and are you going to utilize free T3? Because what that's making me think is that I might have to find another provider to provide these things to me. All right. Number one, are you going to do TSH free T4 free T3 at a minimum, right? You should get a complete wellness panel before you go into surgery. Number two, do I have the option for NDT, T3, whatever my body may need, especially right after surgery? Okay. If they're saying no or like we'll see, big, big red flag. And then the third question I would ask right off the bat is how often are you going to be checking in on my thyroid levels? Like, how often can I come in to see you to optimize my thyroid levels? Okay. What does that mean? At a minimum every 6 weeks, but we know that, thyroid meds, like if you look at the labeling for a lot of the thyroid meds, you can increase thyroid med dosing according to them. Remember, guys, all of this, I have to give this disclaimer as well. Always, 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 this is for education. Before you make any big crazy changes, talk to your medical provider, right? But one thing you always like want to look at is like, okay, what does the prescriber say? Like the people that, not the prescriber, the pharmaceutical company, how they created to utilize it, how do they create it to optimize it? So I have people that wait too long to increase their NDT. which is natural desiccated thyroid hormones, and then they suffer unnecessarily for far too long. Okay, that's not okay. Those are the three areas, because what that means for me is I'm gonna have to find another provider. If these three things are not going to happen, this is where people start suffering unnecessarily. Okay. Do you feel wild, just like this wired feeling after having surgery? That could be cortisol, that can be the thyroid meds, that can be, issues with any of those. Uh, I've recently been diagnosed with osteoporosis. I feel like it's probably from missing vitamins and minerals. Do you see this in practice too? Yes. Let's look at your T3 levels, right? What are your vitamin D status? Are you doing weight-bearing exercises? Across the board in this modern world, mineral status has gone down because of monoagriculture, the way the soil is treated. Um, and I just see that a lot. Estrogen levels. What are your estrogen levels, right? You don't just want to be in the medical range. You guys should be having copies of all your labs so you know where you're at. And a lot of you guys, your doctor's writing you off. Is this recorded? Yes, this is recorded. And you guys will have access to rewatch this for about 5 days to give you guys some time, especially over the weekend. Okay. So, absolutely. And if you're living without a thyroid and you're a woman, there is no question about it. This is vitally important. I need you guys to understand because osteoporosis, bone fractures, is the biggest complication for mortality as we age. Okay? You keep mentioning optimal T4 and T3. What number is optimal? Free T4, let's go ahead and clarify free T4 and free T3. So this is in PGNLs, right? So take that into consideration because you guys might, depending on where you get your labs, might use moles, might use NGL. Anyways, so um, you can do conversion like my range, but so for American ranges, for our ranges, right? Optimal levels of free T3 are usually about 3.4 to upper end of the range, right? And then free T4 is about 1.1 to the upper end of the range. Okay. Those are functional ranges. That's functional ranges for everyone. That is people with a thyroid, as well. But if within that range, and like I said earlier, mildly suppressed TSH in studies, so a bit below, I think mildly suppressed was like 0.5 to 0.03 in the studies. For TSH, found better numbers for LDL, bone health, sex hormone binding globulin in studies, right? And that was in one study specifically, but we've seen that repeated. Now, once you get to that functional range, where you should be depends on you. I have someone that was able to get up to a 4.1. She feels amazing. She started losing weight, and now she feels like, I feel like this might be too much. And I'm like, all right, work with your doctor, get down to a 3.7, and that's where she's getting, and she feels better. It's hormones are an art form, it's a symphony, guys, right? Really, really important there. Okay, I will come back to those questions. Are NDT meds good? Yeah, they are. Natural desiccated thyroid hormones. The reason why a lot of doctors are like, oh no, is because the ratio is different. It's like 4-to-1 versus 14-to-1, which our thyroid does. So you're getting more T3. But in a post-thyroidectomy body, it's like that extra T3 does really well for a lot of people. Remember, what thyroid med's going to be good for you is dependent on your body and your health history. I have a client that was on NDT, and I looked at her markers, and her, like, she couldn't, like, both numbers couldn't get optimal. And I'm like, what does this tell you? She did all the courses, and she's like, I think I let her tell me. She's like, I feel like the NDT, because it's a whole thyroid hormone for me, I need to optimize them differently. So maybe I should try them separately. I said, all right, go talk to your doctor. You got it. You understand it. You know it. NDT is a great, great medication if it's what you need right now. Fantastic. It's whole thyroid. So it has extra stuff besides just T4 and T3. Fantastic. Okay. So let's see. We're going to keep on going with these questions. Even Okay, even when thyroid levels are considered optimal post-thyroidectomy, it's impossible to lose weight. C-reactive protein levels are rising, and severe anemia and more surgeries. If you have anemia, I'm telling you right now, I've seen this over and over again, you more than likely do not have optimal thyroid hormones for you. Because remember, the iron. So in situations with anemia, well, Dr. Beckett, what do you do if I'm in phase one? Guys, I will tell you this, I'm going to supplement. I'm going to supplement until you get your head above water, you're chilling out, you got good thyroid hormones. Then we're going to figure out why did you, like why did you have anemia? Is it the gut health situation? Is it something else? Is there an underlying infection? Well, I will tell you this. If you have high ferritin, I would not supplement because high ferritin means infection, inflammation, and those things like iron. So I wouldn't supplement in that situation. But the anemia will stop you from being able to optimize your thyroid meds. What can I do to help my brain? I'm having trouble connecting my thoughts with my speech. I'm going to touch on nutrition here. One that I find can be really, really helpful when you're trying to optimize your thyroid meds. Um, but we're going to start off with your thyroid hormones first. Then we're going to eat enough protein. You're going to eat 1 gram per pound of ideal body weight. Then you're going to work on the foundational things. You're going to go outside. You're going to get sunshine 3 different times in a day. Before 9:30, midday, and in the evening as the sun is setting. You're also going to go out barefoot. You're going to hit your protein goals because of the essential amino acids. You're also going to increase your fat because of essential fatty acids. Those two things, if you're not eating enough, you're not going to get it. Essential amino acids and essential fatty acids are vitally important for neurotransmitter support in the brain across the board over and over again. But you look at it as a whole, right? My endocrinologist kept my TSH suppressed for 26 years. How could this have caused heart, bone damage? And now I'm menopausal and very worried. What are your thoughts on this? I don't want you to worry, but I right now, if I were in your shoes, I'm getting a DEXA scan. I'm getting a scan on my bone health right away. And if you are postmenopause and you're post-thyroidectomy, I would do it on the frequency as a high-risk individual. I'm going to test my vitamin D status. I'm going to test like a micronutrient test, see what my minerals look like. And if you just want to make sure, get your heart checked out, right? But I would be concerned with being suppressed for so long. I don't know how much they suppressed you for. Look at your free T4, look at your free T3, look at what your body's doing, but don't be scared. Guys, your body heals, your body regenerates. You can change that. Weight bearing exercises three to 4 times a week, increasing the vitamin D, keeping it in functional ranges. I would, for me, keep my vitamin D with A, E, and K, its cofactors, and a magnesium glycinate, like to make sure you get vitamin D into the cell. I cannot tell you what to do, but I would keep my vitamin D at a minimum of a 70, closer to a 90. As I'm doing my weight bearing exercises, I would utilize vitamin D and get calcium through my food. Unless you know there's something with your parathyroid and all of that, and calcium issues from your surgery. But now is the time, and then get your estrogen tested. I like to utilize the Dutch test for estrogen testing, but you can do blood work. Don't be scared. You can get better with that, but that is a concern. That's a problem. Okay, so what happens if you stop taking thyroid medication without a thyroid? Please don't do this. Please don't do this. Your body will slowly shut down and you're going to die slowly. Okay. What are the long-term effect of continued suppressed of TSH? Like I mentioned, is your TSH mildly suppressed? Where is it at with the range? What's your free T4 levels? What's your free T3? Also, can we not downplay? I like labs, but let's not downplay, guys, how important how you feel is. A lot of you guys don't trust yourself because of what the medical system has done, but you have to, like, if you're feeling heart palpitations, if you're feeling off, feeling anxious and racing, that's a problem, right? So kind of look into that. Really, really important. Really, really important. Okay, I'm trying to hit all these labs. I mean, all these questions. Complications to look for. A lot of you guys end up having a lot of crazy symptoms and stuff like that after the surgery. Actually, in my community group, I'm releasing a lymph and scar course for those with a thyroid and without a thyroid. So I have mixed in there. And a lot of you guys don't realize that the scar breaks into the fascia. It can disrupt lymphatic flow. Fascia is connected throughout your entire body. So this scar here can affect like tension up here, TMJ, in your back pain. And it can affect like vagal nerve. And vagus nerve affects like digestion and your parasympathetic and feeling calm. And don't feel overwhelmed. A lot of extra lymphatic work and breaking up the scar tissue can be really good. I missed what that question was. Sorry, guys. But going on, oh, what I was going to say is like, if you guys, I don't know a lot of symptoms specifically to you, the burning in the nerve, that can be something that lasts. But again, always check in with your doctor if you guys feel like that's a problem. Um, I'm 6 weeks out from total thyroidectomy. Would taking a food intolerance test be a good idea? If you're in the US, remember in my community group, you get it cheaper than you would get anywhere else. But let me tell you about functional tests, like deeper testing, like testing the adrenals, testing the gut, testing all these different things. I love all those tests. But I'm going to be real with you guys. It's going to be a waste of money if your thyroid hormones are off post thyroidectomy because every one of those tests will have an issue. They will, because there isn't a cell in the body that's not affected. So usually once you get past that phase one, do the foundational things, then phase two, when you're trying to heal from being hypothyroid, then you can look into that, right? Because low T3, we see it in studies over and over again. Low T3 decreases motility in the gut, decreases H cell production, and all these things decreases enzyme. It can decrease bile. So it ruins the check and balance system that you have in your gut. So that is always going to be a problem. Okay, that is always going to be a problem. I see someone shared their labs. I'm gonna touch. I like to show real lab examples. That's why I do lab check-ins in my community group. But I'm gonna touch on those labs here in a second. So you know, the food sensitivity test. This is the only issue I have with food sensitivity tests. A lot of people do it, especially for kids, and they're like, "Look, I can't have X, Y, and Z. I can't have. I mean, genetically modified corn, conventional wheat, seed oils, like." Problematic things like some people just don't do well with cow's milk because it's A1, These things are, I mean, fried food, I mean, all these things, right? Obviously, things that you more than likely are going to do better without. However, people get a test done and they got eggs and they got bananas and they got almonds. And could you imagine this idea of living your whole life without like all these nutrients? The food sensitivity test, if you have it, it's because of gut permeability and it's leaky gut. It's your body reacting to undigested foods that are leaking out of your digestive system. Okay. And what that means is that you will, as your gut is not well, your mucosal lining is degraded, you're going to have these food sensitivities. But if you heal your gut and you heal your gut lining, a lot of that healthy foods that you are sensitive to, you can reintroduce. So I don't want you to get lost with the food sensitivity side of it, but yeah, I wouldn't be surprised if a lot of you guys do have gut issues because T3 affects all those things. And the next question is, how can I know if my belly and bloating is from visceral fat or high bad estrogen? Listen, your bloating is going to go back to that, right? What is going on with your T3? What's going on with your gut health? I think more than anything, in post-thyroidectomy, your metabolic health, your gut health are going to be vitally important. And yeah, checking out that estrogen levels, testosterone, and progesterone will be really important. But belly and like, listen, I know how frustrating fat can be, but fat is a protective mechanism. Okay, you create fat because you need protection, because your body isn't able to burn as much as you're consuming. Like it is there because it's meant to protect you and your metabolism has slowed down. So, I think that's a really, I think once you get your T3 a bit optimal, or if you don't have access to T3, get that T4 to T3 conversion better, you should work on, everyone here should work on building their terrain. Too many of you guys get kind of like pulled in different areas like parasite cleanses and food sensitivities when you should be working on probiotics, prebiotics, and mucosal gut lining support. And you can get that from food, fermented foods. You can get prebiotics from prebiotic oligosaccharides, right? Like resistant starch, like artichoke and garlic and onions, like all these different things. But if you're eating garlic and onion and you're bloating, you might have SIBO, and that's a whole different approach. So I want you to start looking at your body as a whole and not forgetting how important it is that your T4 to T3 need to be optimal. All right, guys, we're probably going to go 10 more minutes here. We're going over. I'm going to see how I can keep answering these questions for you guys in an easier way. I don't know. There's a lot of really great information here. I did not know so many of you guys would be here and so excited to learn about this. How do I advocate for myself confidently? Oh, and then how do I heal, improve my gut health after thyroidectomy? This is what I wanted to say. I will be honest with you. I have seen a lot of people get better care with a different type of practitioner with their thyroid meds than an endocrinologist. A lot of you guys have been sold on this idea that you can only see an endocrinologist. I love nurse practitioners. I love OBGYNs. I have primary physicians that just listen because in the end, you are it, right? You live. Whatever they give you, you're going to walk out the door. They're done with you. Now you live with that every single day. So finding another practitioner, absolutely. And then you can check in if you got to do check-ins for your cancer with endocrinologists, right? Just meeting with someone that's going to listen to you. How do I advocate for myself confidently? No, you just say no. And then you leave and you find someone else. I have someone that is that I've worked with that has done the one-on-one consult, right? And she needed to be on T4, T3, and I knew it. I can't tell you guys what to do with your thyroid meds. I can only educate you and you make the decision with your prescriber. But I knew what he was putting her on was too low. And he was going to wait like 8 weeks or something. But you know within 2 weeks if the med's going to be enough. And I told her, you got to call him. I don't know. I'm so scared. No, 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 no. This is how you change the conversation in your doctor's office. You don't go in with open-ended questions and like maybe and if this and what do you think and da da da. Hey, I don't feel good. I have X, Y, and Z. I have this, this, and this. And I also teach like you always keep a copy of all your labs. You always know when you have felt great, when you haven't felt great. So you also have a history. If you have to go to a new doctor or if this doctor's resistant, she has a history. So she also has that as ammo. Like I know at this point in my life, I was on this much and I was starting to get better. I'm on this much now. The data's there. Hey, I have this, I have this, I have this. All of this is tied into that. I've worked on all of these different areas. I'm not okay, and I'm ready to try something new. I'm ready to do this. I would like to try. I would like to do. And could we check in? Like you are starting. And listen, I know some doctors out there have egos. I know that. I've dealt with them. Don't waste your time. Don't let them feel bad. Don't. I hate when doctors like I've seen it happen. There was a thyroid surgeon that I saw online that had a mug that was like, "Don't confuse my medical degree with your Google search." Are you freaking kidding me? The Google searches that connects you with other people that are getting better care so you can learn from them. The Google search that is giving you studies that you can read, that is giving you interviews of the researchers that are explaining their research, that is giving you the pharmaceutical companies the best way to use their meds. Don't ever be discouraged. One thing I found over and over again, I listened to a few researchers that did like thyroid cancer or active surveillance. And one thing I found with doctors that are doing research and really changing the world for people post-thyroidectomy or people to avoid having thyroidectomy is they've said over and over again how amazing it is when patients reach out to them because the patients know their studies and that their patients will teach their doctors about their studies. I had another doctor who was interviewed and he did research and he's I I think one of the best things you can do is be well informed so you can have an informed conversation. If at any point what I just said does not go in your doctor's office, that is not a good community partner. You're the CEO. You're the CEO. One doctor, depending on what school they went to, what they were passionate about, what they wanted, what they wanted to focus on, what conferences they went to, is going to feel comfortable doing something than someone else in the next city over or another light over. And that's something that you guys need to understand here. Okay. How do I improve gut health? Um, I have resources on this. Guys, don't drink water while you eat. Okay. Do box breathing, diaphragmatic breathing before you sit down and eat. Your digestion gets affected in a big way. Take apple cider vinegar right at the beginning of your meals to help you digest food better. Take bitters in your meal, increase bitter foods in your meal, or you can take bitter tinctures afterwards. Eat 3 servings of fermented foods. I mean, I love supplements, I love it, but you're never going to get the diversity that you can from um, like you can from food, right? Increase your prebiotics and then utilize things like colostrum, immunoglobulins. I have some ones that I love in my full script store. Work on the terrain, work on strengthening what's there so that your body can respond appropriately. And I know a lot of people have to head out because um, it's like 8:20. I'm going to go about 5 more minutes here, guys. Again, I do want to encourage you guys. I hope I see you guys in my Third Inner Circle community. I'm passionate about this. I love this. I give a lot more applicable things that you can do. There's a lot of learning, a lot of ability to share. My assistant did put the link in here for the monthly offer, the yearly offer. If you guys sign up tonight, you get that lab thyroidectomy. And again, remember, you're getting live Q&As, you're getting courses, depending on the month, depending on what the group needs as a whole, or you're going to get a live teaching session. In the US, you're getting 25% off supplements, cheaper than you would get anywhere else. You're going to get all your labs, functional testing at cost. I mean, I'm trying to make it easy for you guys to get well and feel empowered and not have all these issues. All right. So 4 more minutes here. Check the chat if you guys want to join. And if you do the yearly, my assistant will reach out and set up that um, one-on-one consult with me to help get you guys set up. All right. Oh, how long should my doctor keep suppressing my TSH for cancer treatment if my thyroid globulin is always undetectable? Let me tell you this. This is controversial now. This is not agreed upon approach. TSH suppression for cancer is not agreed upon approach. I don't know your specific case, though, right? So I'm going to give you that disclaimer. I don't know what your cancer, your presentation is, of course, right? If you're in my community group and you ask me a question, I can look at the studies, send you the studies. You can look at it, but this is something that is very controversial now. And a lot of studies saying that maybe this should not be the case. What should reverse T3 levels be? Mid-range. If we work with you one-on-one, can you prescribe? I cannot prescribe. If you work with me one-on-one, or if you do the one-on-one consult, I equip you. So can you add the links again? Oh my gosh, yes. And I'm going to make sure to email it too after we're done here. I cannot prescribe. I teach you how to find someone, work with someone, and know exactly what to ask for because you cannot be dependent on me either. I will teach you as much as I can. You cannot be dependent. You need to be able to go anywhere with anyone and know what to ask for and what is going on. You're the boss. Okay, you're the CEO, right? We'll do more research on a mechanic for our car than the doctor that's going to affect our mental health and our over like our sex hormones, our testosterone, our ability to fight cancer. That's a problem, right? Um, could having the thyroid removed cause C-reactive protein, uric acid to be elevated? C-reactive, I don't know how soon you had your surgery. It can cause C-reactive chronically high is a problem. That's chronic inflammation, but in a healing state, like if you lost it recently, that could be high. Positive ANA doesn't necessarily mean you do have an autoimmune issue, but there could be an autoimmune component there. Guys, thank you so much for sticking around. Okay. You know what? Let me go here. Add the links. I hope to see you guys in there. I'm really, really excited. Please share how to have access to the recording. Post 4 years post thyroidectomy. I forgot to say my endo wants to increase me from 112 to 125 micrograms synthroid, even though my weight is 136. Oh, perfect. I should have said this previously. We have studies over and over again that going off of weight has left post thyroidectomy patients hypothyroid, and that going off of weight is not an accurate approach to thyroid meds. Someone shared their meds here, I mean, not meds, their labs. And I was going to give a little, 4 years post-thyroidectomy and RA. I was recently switched from Levo to Synthroid with minimal changes, still all the hypo symptoms, but now 8 pounds gained. Oh, let me tell you guys this. Is levothyroxine or Synthroid better, right? In the end, it's your body. I've utilized levothyroxine fine. I have people that cannot go to generic and have to stay on name brand. You matter. You matter, right? Suggestions, blood works from 3 weeks ago. Also, I should have said this at the beginning too. Do not take your thyroid meds before labs. Don't take your thyroid meds before labs. Your body peaks. So I don't know. I don't know if you're still here or not, but I don't know if this is with labs, without labs. Within 4 to 6 hours after taking T4, T3, they're going to peak in your blood because your body's processing it. That's not an accurate number. In fact, the ranges on your lab work do not align with you being on thyroid meds when you get labs done. Reverse T3 is a 21, free T4 is a 1.7, TSH is a 1.04, and free T3 is a 3.2. So this is someone that could possibly do okay with just on Synthroid, but you are not optimal with that free T3. And that reverse T3 tends to be, this is kind of how I do my lab live check-ins. This is how I do it, right? And usually I have people like unmute so we can talk. So the reverse T3 tends to be the upper range, depending on where you get it done, can be a 23 or 24. So you're creeping up on that top band. So what that's telling me is that you might be pushing that free T4 too high, and now your body's trying to protect itself, putting it into a free T3. Or sorry, putting it into reverse T3. So what we're seeing here is congestion. That free T3 needs to be optimal. I don't know if you are low carb. I don't know kind of like your history here, but my first thing is like, number one, if I were in your shoes, I did not feel as good on our, I don't know which one you felt good on, whatever. Like that might be something to be like, hey, I want to go back. I feel better on this. And also, increased conversion. T4, doing like a liver cleanse is my favorite liver cleanse that I do. Amazing. That's in my shop. It is 2 weeks long. It'll help clear that out. And then you work on increasing nutrients like selenium, checking out your iron and your ferritin, zinc, magnesium to help increase that T4 to T3 conversion, because that free T4 is on the upper end of the range. All right, guys, can you Oh, here you go. It's still here. Didn't take meds before labs because I heard your podcast. Way to go. Good job. But yeah, you've got it. Are you low carb? You're still here. I don't know if you're low carb. Because if you have lower amounts of carb, T4 to T3 conversion automatically goes down. Sort of. See, guys, I know what I'm talking about. Refeed before your labs. Because right now, this might simply be that you don't do well with Synthroid and you might do well with Level. Your body is yours and you're uniquely yours. You refeed. Why? Because you want to see, am I converting T4 to T3? Because when you eat good, healthy carbs, your insulin goes up. So T4 to T3 conversion goes up. Okay? So, I mean, there's a few different factors here that will be really important for you to look into, but really good. Thank you so much for sharing that. All right, guys, so many questions. Please keep an eye out. I think maybe what I might do, I am probably going to do a recap in my inner circle community on these questions. I think it'll be really beneficial for everyone. What I taught on, just have a document, it'll be on there. So if you guys join, you'll have access to that. Listen, the biggest thing I want you guys to understand, thyroid med optimization is a lot more detailed and specific to you. You can get optimal even if you don't have access to T3. You can. If you are in a place that you have T3, we got to work on getting it. You got to work on finding a practitioner, walking in, and asking exactly for what you need, right? Your body is a whole, right? You're not broken. You're not broken at all. You're going to continue to heal. And I know they made it seem like it was like an easy thing to lose your thyroid, but long-term healing, that's the name of the game. You need to keep learning. Nothing matters more than this in this world, period. You've got to learn. Nothing, you don't have time for your health. You don't have money for your health. When you lose your health, what do you end up having to use? Your time and your money. You've been through it. You went through thyroid surgery. Listen, when I went through my thyroidectomy, my thyroid cancer, and I learned everything I learned, from that moment on, at just 21 years old, my health, how I eat, my supplements, my testing, what I've invested in my health has been the biggest expense I've had in the last 20 years. And listen, I can't control everything. We live in a toxic world. I can't. But if I can control some things that can keep me out of being in that doctor's office and hearing I have cancer again or hearing that I have another issue, I'm going to do everything possible that I can. And you guys get it. You guys understand because you sat there too. And I want to encourage you that you can do that. All right. So thank you guys so much for tuning in. This was so fun. I can't wait to do more live sessions with those of you guys that end up joining. I love doing this. I love all of you guys being here and not settling. Again, we'll send out an email for the link. Make sure you guys, anyone that signs up today, remember that that course is really good. So you're definitely going to want to do it, the labs for post-thyroidectomy. But thank you guys for tuning in. You will have my Thyroid Inner Circle doors will only be open for 5 days. You will only have access to this for 5 days. Rewatch it. I know I talk fast when I'm trying to, I didn't even get to go over all of my studies, but this is just a starting point, opening up the door and understanding what true healing looks like post-thyroidectomy. I'm so proud of you guys, and hopefully I'll see you guys in my Inner Circle community.